Dependence stands for the state of relying on or being controlled by someone or something else. It's a fascinating topic, and this is exactly what we are going to deal with at our workshop that has been well designed and refined over the last few years here at UKCHH. We look forward to welcoming you. It's going to be a packed day. We're not going to ignore subjects such as alcohol addiction or substance misuse addictions, far from it. But we're going to dive into a range of different types of stimuli or stimulus that leads to or can create an addiction and a dependency. For instance, social media. Social media is on the rise. In the United States, there are records that almost 10% of people that use the internet, including children, tend to develop an addiction. Here in UK, the percentage is slightly higher according to studies, but in my experience, it's underreported. It's significantly higher than it needs to be. So we truly need to understand addictions and use a cognitive behavioral and a systemic approach. What do I mean by that? Well, cognitive behavioral therapy is one of the few treatment methods, psychological treatment, of course, that covers the area of addictions so well. We're interested in cognitive factors that maintain an addiction, such as beliefs that justify our addiction. I'm entitled to this. I should use because if I use, I'm going to feel better. We have a range of feelings, symptoms, that our physiology changes in response to such beliefs. And we develop cravings, this internal urge to impulsively act and go forward towards our drug of choice or stimulus. And of course, we have a series of behaviors that trap us into the continued use of our favorite drug or stimulus, whether it's the internet or whether we're talking about alcohol, a stimulant such as cocaine, an inhaler of sorts, which are on the rise in the UK, and we've seen recently on the news, those small gas canisters, for instance. Whether it is internet porn or even physical exercise, such as bodybuilding, sometimes we become dependent and we fall in the trap of addiction. And once we do, it's very difficult to get out of it. This is where clinicians, therapists like us come into the picture. And then we should be able to not only explain by using perhaps the medical disease model and other types of psychoeducational methods, to explain to our clients the traps they fall into. But we have to offer instruments, tools, strategies that help them every day to deal with these challenges, with the cognitive challenges, physiological challenges, and behavioral challenges. Help individuals install coping skills so they can disrupt these vicious cycles. Develop independence and self-efficacy so they can by themselves in their own environment reach their potential and achieve their goals without having a substance or another type of addiction getting in the way. My name is Daniel Miria. I'm a CBT therapist and a lecturer. I've been doing this for over 35 years. I have a particular interest in addictions and dual disorders. So that means an addiction in parallel with a psychological disorder, which is almost impossible to separate sometimes. I look forward to sharing with you some of my thoughts, ideas, and treatment methods, as well as the NICE recommended methods here in UK. National Institute of Clinical Excellence has a series of CBT methods at its disposal that are currently used within NHS. I look forward to welcoming you on the day. It's going to be a busy day.